Hi, my name's Allison O'Hara, and I'm here today to talk to you about smoking while pregnant. Would you ever add a dollop of lead and cyanide to your baby's strained peaches? How about indulging on a side of nicotine and carbon monoxide? Dr. Welch, an OBGYN at Providence Hospital in Southfield, Michigan, believes that pregnancies would be safer and babies would be healthier if pregnant smokers could somehow swap their habit for a serious disease such as diabetes or high blood pressure, according to Woolston in 2016. Research suggests that smoking while pregnant increases the risk for complications because smoking during pregnancy can cause tissue damage in the unborn and newly born babies. And studies show that there's a direct relationship between smoking and miscarriages. First, I'd like to talk to you today about how smoking while pregnant increases the risk for complications because tobacco use during pregnancy can cause damage in the unborn and newly born baby. Then I'd like to describe how there's a direct relationship between tobacco and miscarriages. To start, let's look at how there are multiple problems associated with tobacco use during pregnancy, which can cause damage in the unborn and newly born baby as well as the mother. The most common complication for babies whose moms smoked during pregnancy, according to Woolston in 2016, is congenital heart defects, which are problems with the structures of the heart. These heart defects are 20 to 70% higher than for babies whose moms do not smoke. According to Woolston in 2016, another common health issue linked to smoking while pregnant is babies born with cleft lip and cleft palate. Smoking can also cause babies to be born with a low birth weight, which can lead to other health problems and disabilities like developmental delay, cerebral palsy, and hearing or vision ailments, and in extreme cases, even death of the newborn. Lastly, according to Woolston in 2016, babies' lungs may not work on their own after they're born to a tobacco-addicted mother. This means that they may spend their first days or weeks attached to a respirator. Children whose mothers smoke during pregnancy are especially vulnerable to asthma due to the adverse effects of nicotine. And now that I've described how smoking while pregnant increases the risk for complications because tobacco use during pregnancy can cause tissue damage in the unborn and newly born baby, let's move on to my second main point about how there is a direct relationship between tobacco and miscarriages. Studies show there is a definite correlation between mothers who smoke and miscarriages. Carlson said in 2016 that placenta previa is a huge risk factor of smoking while pregnant, and that can cause miscarriages. Placenta previa takes place when the placenta stays in the lower part of the uterus and it is either partially or fully covering the cervix. Many times, the placenta tears, causing excessive bleeding and deprives the fetus of vital nutrients and oxygen, which can cause a miscarriage. In 2016, Carlson said that an additional risk factor which can cause miscarriages is placental abruption. Placental abruption occurs when the placenta separates from the uterus prior to childbirth. This devastating complication can cause severe bleeding and can be life-threatening to the mother and the baby. Additionally, an ectopic pregnancy can cause a miscarriage. And a miscarriage can occur because nicotine causes contractions in the fallopian tubes, which prevents an embryo from passing through. The fertilized egg implants outside of the uterus, either in the fallopian tube itself or in the abdomen. In this case, the embryo must be removed immediately to avoid life-threatening complications to the mother. In conclusion, these 2 points together support my claim that smoking while pregnant can cause tissue damage in the unborn baby and newly born baby, and studies show there's a direct association between tobacco and miscarriages. I'd like to draw your attention to this visual aid behind me from the Australian government. It points out some key ideas to help you quit smoking. Number 1, delay. Delay for a few minutes. The urge will pass. And number 2, deep breathe. Breathe slowly and deeply. Number 3, do something else. Phone a friend. do your prenatal exercises. And number 4, drink water. Take time out and sip slowly. With tips like these, they can help you beat the cravings. And WebMD offers some additional tips to help you kick the habit. And they are, number 1, remove all matches, lighters, and ashtrays. Number 2, designate your home a non-smoking area. And number 3, ask people who smoke not to smoke around you. Finally, the March of Dimes in 2016 offers hope. Don't feel badly if you can't quit right away. Keep trying. You're doing what's in the best interest for you and your baby. Thank you so much.